Do you know the linkage between stunting and aflatoxin?
Oh yes, I'm very well aware of that. And actually, that was one of our main reasons to start working on mycotoxins. Aflatoxin is one of the mycotoxins. And we were promoting groundnuts, for example, to be used for children's food. And we realized we might be doing harm by promoting foods that are very prone to mycotoxins. So we started working on it and we realized there's a huge gap because most of the work that is being done on mycotoxins focuses on marketed food. And what remains at the household is the food that is not safe to eat. So we wanted to make sure that that gap is filled. And that's the work that Dr. Matumba did on our behalf. And I'm so glad we have that conversation today with Dr. Matumba and Vitove telling us more about their work on food safety.
Well, if you want to find out more, keep listening to this episode. Welcome back to another episode of the Over to You podcast. And this is a podcast series where we discuss the learnings, the successes, and everything in between that the Food and Nutrition Security Project of GIZ Malawi was able to accomplish in the period of 10 years that it was under implementation. Today, we are discussing food safety. And in the studio with me today is Professor Limbikani Matumba, who happens to be the professor in food safety and also the dean of faculty in life sciences and natural resources at the Lilongwe University of Agriculture and Natural Resources in Lilongwe, Malawi. Welcome, Professor. It's an honor to have you in our studio today.
Thank you so much.
I'm also joined by Vitove Bach. Vitove Bach is a nutritionist in the GIZ Food and Nutrition Security Project in Malawi. Welcome, Vitove, to our podcast today.
Thank you, Zainab.
I had a conversation with Martina when we were discussing, the food safety episode. And she just gave, a brief overview of why we needed it. But it was really an interesting, brief that she shared. And I think I would want everybody to sort of understand why we are here to discuss food safety. Because the Food and Nutrition Security Program works to promote food and nutrition security for children and women of reproductive age. But food safety is a whole different component altogether. Why are we here, Vitove? What is the genesis and how did we get here?
Thank you so much, Zainab. I would say GIZ Food and Nutrition Security Program has been implementing its interventions in the districts of Dedza and Salima for the past 10 years. And this is our last year in terms of implementation. But whilst we were implementing our interventions, we realized that there were some elements that were affecting our do no harm principle. Because as a project, we promote enriching child's food with various items, and one of them is the use of groundnuts. But if you look around, you read the literature that is existing out there, you realize that in Malawi, most of the groundnuts are affected with aflatoxins. That's what we realized. That's what we learned. And this, we also learned that it's the same thing with the communities that we were interacting with, where we are saying you need to give your children porridge enriched with groundnuts, or even the vegetables enriched with groundnuts, and yet the groundnuts are affected by aflatoxins. Yeah. So we said, what is it that we can do as a project? Do we have to withdraw the promotion of groundnut consumption amongst our project participants? Or there's something else that we can do? So that is what led us to interact with the LUANAR in terms of what is it that they do as a department when it comes to aflatoxins. So when we were reaching out to LUANAR, it was mostly to see their work that they do around food safety, so that they could advise us in terms of what is it that we can do in the communities. And at the same time, when we're also doing our background work, research around what is it that we can do, we realized most of the partners or the projects that are out there, when it comes to giving a focus on food safety, it is mainly focusing on the markets and not the communities. So we look at, I would say, the urban users, forgetting about the rural communities where the production is done. Yeah. What is it that they are consuming at household level? Mm-hmm. So that is what drove us to say, no, I think as a project, there's something that we can do to also help the producers, which are the smallholder farmers that we as FNSP interact with in the districts of Dedza and Salima. As you know, these are rural communities. So with that background, we reached out to the university, and luckily enough, we got hold of Professor Matumba, who is here with us also today to share more in terms of what we did. But the first part that we started to look at was in terms of having conversations, not just with LUANAR itself, but also other stakeholders, to just brainstorm in terms of where are the gaps, what is it that we can do, also more from the perspective of us being a nutrition project, to say what are the interventions that we can do to support the rural households. So besides reaching out to LUANAR, we also reached out to our political partner, the Department of Nutrition, so that we could co-create all this. And I think I can pause it there. Thank you.
That's quite an interesting one. I think I would now want to hear from the professor, because you reached out with the aflatoxins in mind. You also mentioned about urban users and, the selling concept, because as you mentioned, there's, when people produce, like in the rural areas, groundnuts is often for resilience most of the time. You're producing to sell, not to eat. It's what remains that you're like, no, let's eat. But then I think that's where the do no harm principle comes in, because you keep what's not desirable to the market to eat. And that's where most of the issues that, are clashing with the do no harm principle for the, toxins and all that. I would want now to hear from the professor. How did you take it from where FNSP, reached out to you?
Yeah, it was really very exciting. I remember at that time I was doubling, so I was a professor, and then at the same time I was also a director of research.
Oh, wow.
So we at LUANAR were complaining that yes, we were doing a lot, but then perhaps we're not doing as much on the ground. So it just happened that time I'm head of research and I'm wanting more from people, and then FNSP comes in and they say, okay, can we team up? So I'm saying it was very exciting because it was like a platform. Because now there was somewhere where I would now, link with the ground. It was a good platform for me. So they are focusing on aflatoxin. So when we were discussing, I realized that they were just blaming, perhaps just focusing on aflatoxin. I felt perhaps there could be more. I said, what is it that you're doing on general food hygiene? We already have this. I said, okay. Yeah, so I guess you are aware of the WHO 5 keys to safer food. The WHO 5 keys to safer food is a general guideline, which has, of course, the 5 keys. So these are: 1, keep clean, separate the cooked and the raw, and you also cook thoroughly, and also keep at safe temperatures, and of course use clean water and raw materials. So we started a conversation around that. How much have you done around this? Then in our conversation, we realized that yes, a lot has been done, but perhaps there could still be some gaps. So we thought of having a platform. We had an engagement where we gathered all important stakeholders around, and then we identified some gaps. And doing the resolution from that conversation, thought perhaps we could do a survey in Dedza and Salima, just to know how much and what are the gaps. And
Can I quickly come in?
Yes, please.
Let me also say that, as you have heard him say, one of the recommendations is that we should do a survey or a study. When we were reaching out to LUANAR, that's not what we had in mind as FNSP. Our idea was that we are just going to LUANAR. They already have clear set indications to say, this is what you're struggling in this area. This is what you can do as a project, like clearly set rules. But then to our surprise, it was like, now we have to do a study. This is not something that we had planned. Let me just say also, this is one of the unique features of the GIZ FNSP project. It had some flexibility in terms of what is it that you can still learn through the process of implementation, and then you can, make changes to your programming. I just wanted to share.
I think that one.
I totally agree with that, because throughout all the episodes that we've been able to do, there's a lot of learning within implementation that has been happening, and a lot of interventions coming in as why are we here? Let's, go back. Let's start again. Let's try that. There's that flexibility I think listeners, maybe if they're in implementation, could learn about. and also maybe see if they could adapt some of the things within. You don't always have to be, this is what we want. At the end of the day, we know we have got indicators that we report to, but also that flexibility actually helps, to address a whole lot of other issues that come in within the course of implementation, I think.
I think that's something that I would even say this is the biggest lesson, because there was a lot of flexibility. And I was really, that was from 2019?
2019.
So I've always claimed that I've been part of the program.
Oh, you are.
Because we started the journey in 2019, and it's been a journey. We don't know where we're going, and things just keep on coming. We had this WHO 5 keys as our framework, and then we designed a study. We actually had a lot of co-creation sessions, and I would say much of it was even coming from the FNSP itself, because we even published a paper, and the first author is actually Victoria herself.
I actually did see that. Congrats!
So we're trying to make sure that we really see how close are we to the WHO 5 keys to safer food. So we framed questions around the 5 keys, and this was touching all aspects from the mycotoxin, the aflatoxin that was the focus, to other aspects. And I should also mention that mycotoxins are not adequately covered in the WHO 5 keys. So I'll talk about it later.
Okay.
But now what we found from the study is that whilst we've been working, FNSP and other stakeholders in Malawi, there are still a lot of gaps. Because what we found was that the mere hand washing, we found that 90% of the respondents do not wash their hands after using the toilet. And this is something that we found.
But that's basic hygiene, really.
Basic hygiene. But now, these are women, and women are very critical in food preparation, and these are confessing that most of the times we don't wash.
Oh my.
And we also discovered that only 10% of the households had functional tip taps. So tip taps are, we don't have taps, so we have these improvised...
The makeshift ones.
Makeshift.
In Chichewa, they are called impondagia.
Impondagia,
right?
yes, the impondagia. So we found about 10%. So when I say functional tip tap, I'm talking about something that has water in it, and there is a sign that it's been in use. You know where something has been in use. There was some moist, and that perhaps the soap. Soap was not even there. And we also discovered that even the tippy tap was not there anywhere around the kitchen area. So the tippy tap was only situated in the 10% closer to the toilet, and not in the kitchen area. And that was a huge
food safety issue.
Yes, issue. Because
the understanding is it's only supposed to be in the toilet.
Yes.
So even if I've been touching everything around the house, I can just go into the kitchen and, carry food and do that.
So if you
That's
don't
really
have
huge.
running water, it means you are, in a way, you are either using stationary water. So it means all the preparation in the kitchen is being done suboptimally, I would say.
That stationary water, like every time you come in, you're just transferring germs to the water.
Yeah, like contamination. So that was some of the findings that we, simple stuff. And we also found that most of the toilets that were in use were unimproved. Only 40% of the households had cover of the toilets. So it means flies in 60% of the households, flies would go in and get out. And we also
go directly to food.
And we also discovered that significant proportion of women confessed that they would cool porridge in their mouth.
Oh my God, is that really a thing?
It's happening. And even here in town, if you're not doing it, your nan might be doing it.
Oh my God, that's so scary.
And we also found that the other key is keep food at safe temperatures. And we found that, obviously, the households didn't have refrigeration. So key number 4, obviously, was almost not adequately. So I did mention that it's very hard for a woman to actually go and get a pailful of water. And at times even, they would actually work very early, 3 a.m. They go to a well and they'll be waiting to get water.
True.
So that is a barrier, but it doesn't change the fact that you need adequate clean water to achieve food safety. What that means, the government has to recognize this, that for someone to achieve food safety, there is this key, keep clean, and this is not possible without water.
Yeah.
So the government has the responsibility to make sure that each and every person has access to water. That's the responsibility of the government.
Because it's not negotiable. You can't negotiate
it's not negotiable.
Yeah, that's true.
Because the germs in the West, where this is actually, it's the same.
Yeah.
Right? And we need running water here to achieve that. And it has to run in the villages. Of course, we've managed to also look at others, but also even the social, because it's only the woman who is actually going to draw the water. Can we also now make the men also go to get the water whilst we're waiting for the government to...
That's a huge gender issue.
Yes, yeah. And then there are also other aspects. Of course, we can go around on the keep food at safe temperature.
Yeah.
We'll do ferment, we'll dry, we'll do all that. But then we need also to move our economy towards refrigeration.
Yeah, that's true.
Yeah,
that's
so
true.
again,
Energy.
this is the government and us. We need to work together to make sure that our economy grows, that we are able to get a refrigerator and that we have a freezer.
Yeah.
Otherwise, it's a tall order to actually...
It is a tall order, because when you look at the energy consumption, even access to energy, that can actually have somebody have a refrigerator. It's a very small percentage and mostly concentrated in the urban space.
Sure.
And even the financial capacity to own, to be able to buy,
Yes.
that buying power is also really... You're looking at somebody who is basically surviving, like trying to just find a bag of corn so they can feed their family. It's really a tall order, as you
Sure.
say.
Soap is a very critical element. But now they'll actually tell you, why should I have a tablet of soap on the tippy tap when I don't have a tablet to actually take a bath?
Yeah, that's a good question.
Okay.
Yeah, that's
I think
true.
he-
That's totally true.
Now going to mycotoxin. So mycotoxins are secondary metabolites that are produced from certain genera of fungi. Okay. So we normally see fungi growing. When the fungi is growing, it will produce some poison on where it's growing. This is invisible, to our naked eye. But now the toxin that is produced is very stable. You boil it, it doesn't get destroyed. So it's produced on the food, and then it's there. And it would cause a lot of heavy problems, ranging from cancer to depression of immunity. And sometimes even if it's taken in large amounts, even it can even cause death when it's inacute.
I've heard it causes stunting as well.
Yes, it does. So how it works, there is a range of explanations, but one way is that the body itself would shut down the system to prevent the body from getting the So it will, at the same time, the nutrients will also just be gone. So you ate an egg, but now the system is also shutting because it doesn't. That's one.
So it's not getting the
yes, but
nutritional
also
content.
the toxin itself will also injure the gut. So instead of it to maximally absorb the nutrients, then it's injured and most of it will just go. So perhaps you might have heard about the leaky gut.
So I think that's why it was even very important for us as a nutrition project to work on this topic.
No, now I'm understanding that do no harm thing. It's
Exactly.
like a huge thing because, from the way Professor, explained it, I think for me, initially I was like, it's just surface thing. But now there's so much layers to that do no harm that I think you worked on when you now started engaging them.
And you look at our indicators, we are saying that we are promoting the consumption of diversified foods. And then one of the diversified foods for the children, you are saying they should consume groundnuts.
Yeah.
And yet the groundnuts are contaminated.
Wow.
And then we are saying that we need the children to retain their nutrients in their body. And yet with what Professor has just explained here, then it means we will not be able to realize our indicators.
Yeah.
At the end of the day, we'll be blaming ourselves to say, okay, but we are promoting these interventions without realizing what is it that is hindering us from achieving our goals at the end of the day.
Wow, that's interesting. So in case you're just joining, you are listening to Over to You podcast. And in today's conversation, we are discussing food safety. Today, I'm joined by Professor Limbikani Matumba, who happens to be the professor in food safety at the Lilongwe University of Agriculture and Natural Resources. He also happens to be the Dean of Faculty in the Faculty of Life Sciences and Natural Resources. I'm also joined by Vitoe Bach, who is a nutritionist in the GIZ Food and Nutrition Security Project. The Over to You podcast is brought to you courtesy of the German Development Corporation. Now, back to the conversation.
On mycotoxin, we found that women would go to the market and buy any visibly muddy foodstuff because they didn't know. They don't know about what we're talking about.
They wouldn't mind.
Yes, so as long as it's palatable, then they are not scared because they don't know the consequence of consuming such. So I would say 100% of our participants had reported that they would buy muddy foodstuff.
So when you got these, findings, which are really overwhelming, I must say, what did you do?
Like I said, it's been very fluid project. So immediately we realized this was a very good platform. We realized the gap that existed in knowledge. Yeah. So immediately we then synthesized literature that already exists, and we came up with a framework. Okay. And this framework was the first of its kind. We then generated the 5 keys to prevention and control of mycotoxin. So what we did was we looked at how can a household prevent moths from contaminating the food. So we started from the field. So we said, okay, how do we make the plant resilient? So we have 5 keys, and this was published in 2021 in Global Food Security, which is a very high impact journal. And the framework I would say, this was to address what we had discovered on the ground, but we thought the very same problem that we are facing here, Tanzania and other countries would also face the same. So that's the reason why we published it. So one other aspect that I would say is actually major from this is that we published that framework. So when we realized the gaps that a lot of women didn't know what to do to control the mycotoxin and the practices, then we published a framework. And that was the first of its kind. And we published that in a Global Food Security journal, which is a very high impact factor journal. We published a paper called 5 Keys to Prevention and Control of Mycotoxin in Grains, a proposal. And this framework has, like I said, five keys. So the first key is to sustain crop health and vigor. The second key is to reduce toxigenic fungi, to reduce the fungi that produces the toxin. Okay. The third key is to dry rapidly. So these are modes. The modes want to grow when there's moisture. So we thought of how can we make sure that this is controlled? And then we also, because this was a framework on grains, we also had another key on safeguarding the husk and the pericarp. Because the pericarp and the husk of the grain is actually a natural barrier which will protect the grain from the fungi because it's hard. God has been, is really a great creator. He's protected. So if you damage the husk, then you make it prone to contamination of the fungi. And so the last...
For a layman like me, a husk is a cover.
Yes, it's husk or pericarp or tester. The maize, the grassy. Yeah. Yes, Okay. And even for groundnuts, which is actually a topic today, you have the husk, and then you have the kernel inside it.
Yeah.
So if you have a groundnut which is well covered, the chances of having the groundnut
toxins.
itself attacked by moths is almost zero. So what we did was to create this 5-prong framework, and then for each, how do we sustain the plant's vigor? So we also prescribed a number of items to say, for example, you plant agroecologically adapted varieties, and that you improve the soil fertility, and that you plant healthy seeds, and that you make sure that you maintain adequate moisture. So all these are the general good agricultural practices. The unique thing that we did in this framework, we followed the WHO 5 keys, where you have the what, the how do you do it, and the also why should you do all that, and which is very easy to follow, because you are giving the action, and then the reasons, and also how that should be done. So that was one thing that we did. And the second thing that we also did was that we still felt most of what was being considered as risky, like the groundnuts, were really very nutritious. So we thought, how best can we still give the nuts to the children, because the nuts are very nutritious. So we had an experiment. This was not on the cards, and because of the flexibility of the project, we said, okay, so the next thing is, can we now see how much would, let's say, hand sorting do? Hand sorting is already documented to be one of the strategies of reducing mycotoxin. But now, how much would women employ it and effectively reduce the toxin?
Yeah.
So we bought very bad nuts. We took it to the women in Salima and Dedza, and we had recorded how much toxin was in there. I remember, I think it was around 500 parts per billion, and that's quite high. And after hand sorting of different strategies, different methods, we realized that the reduction was 99% or over.
Wow.
It became actually quite usable. So much as it's prone to contamination, but it's also very easy to do. And we witnessed that from our study. And it was throughout all the groups.
No, sure. Maybe even you would be surprised to say the simple act of hand sorting.
Yeah.
So maybe even growing up, when you visit the village, you find that our grandparents, this is something that they usually do, right?
Mm-hmm.
Like you find them sitting down, they are doing the hand sorting and everything. But when they are doing that, the question that one would also have is, are they thinking of aflatoxins or mycotoxins in mind?
Definitely not.
Not at all.
Not.
Yeah, but maybe because they realize, this one doesn't taste good in the mouth, so I need to, But then even in terms of the quality, when they are doing the hand sorting, maybe the quality is not there. I should say, when we came up with that intervention, taking it to the communities, you really noticed the difference. Because we also had the group that was actually taught in terms of the hand sorting, and the other one was our control group. Like, you just leave them do the hand sorting, and you would notice the differences. Exactly. Maybe that's...
hand sorting, oftentimes, like the grannies, when they're sorting, it's like they're taking out stones most of the times. Like, if there's a stone here, I don't want to bite a stone when I'm eating. And, when they find the groundnuts with, toxin, they're like, there's a lot of other good groundnuts, so it's just going to mix. That's the whole ideology people have.
Exactly.
I don't think it's ever been like the way you're describing it. Like, okay, so let's take out the toxins. No.
Yeah, I think you're very right. So we had asked them to sort, and they sorted, and they removed the toxin. But now the question is, do they do that all the time? So the answer is actually coming from our previous study. So we found that they don't sort. Because the motivation is that of palatability.
Exactly.
So it's the nuts which we gotten and took them to the women. Women would just take them and consume them. But now we had asked them to, so can you sort this? So it's something that is unnatural, I would say. But then the good news is, if we can encourage each and everyone to say, sort, because if you don't, there is this danger. Because what they don't know is the danger. Yeah, so that's the biggest lesson. There is a problem which people don't realize. But now, if you can alert them about the problem, they would be able to control from the field through to the fork.
Yeah.
Because it's harmful, but it is something that we can manage. And that's a good news that we should be spreading.
Oh, wow. I like that. So you also did mention that you did some publications. You mentioned something that touched on good agricultural practices. So I do know that when you go to the communities, these people are producing the food, but for them to follow good agricultural practices, there's a government structure that is governed by the extension workers. I don't know if you've had anything to do with them, especially since they are the ones advising the people in the community on good agricultural practices.
That one is also a very good question, because what happened is that we found the gaps.
Yeah.
Then we created the framework. We published. This is global. So we thought, this was like a platform, and then we informed the whole globe.
Yeah.
But now we needed to do something. So quickly, we packaged the same material now in a manual. And that we did with the same project, working now with the Minister of Agriculture. So as we talk, we have a manual that the extension workers are now using, which is actually a product of this. So we repackaged the 5 keys to control of modes and, and prevention and control of modes. And now it's well documented. Is it a 20-pager?
It is
20-pager with all illustrations and everything. It's been published.
Actually, if you ask me, what is it that we have done as a project, also contributing to a lot of aspects in the country, maybe with regards to your question, I'm also thinking of issues to do with sustainability. Like, what is it that we are living, since we are saying over to you?
Yeah.
So there are several things. If you look at what Prof here has talked about, contributing to the literature that is out there, that's the paper that he has talked about. Actually, there are also 2 papers that we have published.
I was actually going there now.
Okay.
That was just on mycotoxin.
Okay.
So we realized, so we have the WHO 5 keys, which is looking at all this, and it's a really excellent piece of work, because that's our springboard. But now we realized in these 5 keys from WHO, mycotoxins were completely not tackled.
Wow.
And that's the reason why we said, can we now do this? Now, I can understand, because most of the framers of the WHO 5 keys might be coming from the West, where their food system and our food system is completely different.
Yeah.
So they've actually tackled that indirectly, because they talk about clean raw materials. But now, for us, we produce our own food. We produce our own poison. We consume it. We needed to tailor or adapt the WHO 5 keys now to our needs. So we realized, can we now bridge this? How do we control them? So hence this one. Now, after that, that's when we then drafted another paper where now we had a perspective. So we recognize, of course, the greatness of the WHO 5 keys.
Yeah.
But now we realized that there were these gaps, and then we thought, what is it that we can do to adapt the WHO 5 keys? We introduced the mycotoxins in the manual.
In the manual.
Yes,
okay.
adapting it. But also, we realized that a lot of information gap that we got on the ground from the study was that the actions have been prescribed, but now there are not sufficient reasoning has been provided. So I'll give you an example. They say, wash your hands. It doesn't state about washing hands using running water. Because it's taken for granted that it will be running water. It will be running, because the framers are actually coming from
where running water is like a basic thing.
Yes.
Yeah, that's
so
true.
you need to explain that washing your hands in a static basin and washing your hands from a running tap or running tippy tap is different.
In fact, in most rural communities, you cannot wash hands easily in running water, because you'll be wasting now. Because a whole family of 6, they'll be like, Dad starts washing, same basin.
Exactly.
And then mom, and then kids, and then the last one, the youngest one will be the last to wash. Same water, like it's now dirty with everybody's germs, and you're eating the food.
In fact, you've actually brought us back to our study, because we also looked at the barriers.
Yeah.
So we looked at the 5 keys. What is it that would hinder someone to follow these basic principles?
Yeah.
And the water scarcity is a huge barrier. You know, water is drawn by a woman
Yeah.
on the head.
Yeah.
And we found that in many circumstances, it will take 30 minutes to go to get pailful of water, or even more. You need to spare the...
Yeah, true.
Yeah.
True.
So to run it, which is actually the efficient way of doing it, would be wasteful. So that's another thing. But now, what I'm saying here is that the explanation to say it has to run and to explain why running water is not in the guideline. So what we've done now in our tailored now guideline, we've actually brought that kind of reasoning. So there is an action, and then we explain why that action has to be taken and how that has to be done. But now, even in the how, we also explain why it has to be done that way. So if you are washing your hands, you have to wash with soap. What does the soap do? So the soap would actually degrease, will remove the germs, and then the water, the running water, would then provide the shear force to remove. Because if it's static, then there is some sort of recontamination. So that's what we've actually done now to the manual. So we've produced a tailored manual for developing countries. It's not just for Malawi. And then out of that, we've actually now produced counseling cards. So we've even gone down to explain this. We have a 90-page document explaining now to the extension worker, so that now the extension worker is more informed. And this has also been now translated in Chichewa. And we hope to even translate it in various other languages with very good pictures and stuff.
Maybe just to add in terms of the resources that we have put out there from all the work that we've done, we've also added a counseling card. So on the receipts, so a counseling card where even an extension worker, now even maybe going back to the point you raised, Zainab, to say, how have you been engaging the extension service? So throughout our work, we've had the extension services from agriculture and also from Ministry of Health. These ones have been part and parcel of even creating the content, because they are the ones that are working so closely with the communities. They know also the gaps, and also the gaps in terms of what they would need as they deliver materials to the communities. So the extension workers, they've been part and parcel of the whole process.
In fact, they've been the engine. I would say we've only been facilitating. I remember at one point we were in one workshop in Ponela. You would see how much information is coming from these. So it's just, we've just repackaged, and it's an incredible product that we've gotten from it. Yeah.
But how do extension workers feel about this? So we had conversations with some of them, and this is what they had to say.
My name is Grace Malawi. I work as a food and nutrition officer for the district council agriculture sector. I'm based at the district agriculture office. I have been working as an extension officer in DESA for almost 2 years now, and over the years I have been working closely with households, schools, and also local health facilities to promote food safety and nutrition practices as a way of improving the well-being and overall nutrition status of the community. I have been working with the FNSP for 2 years now in various capacities. For example, I've been working with them in training households in various nutrition concepts, food safety or development of seasonal food availability calendars, and I have also been conducting awareness campaigns on hygiene, foodborne diseases, and also dietary diversity. In addition to that, I have also been working with the FNSP team in monitoring and evaluation of nutrition practices at the household level. Food safety mostly refers to the proper handling, preparation, storage of food to prevent contamination and foodborne illnesses. It basically ensures that the food remains nutritious, safe, and free from harmful bacteria or any other chemicals for any physical hazards. I learned about food safety through some of the training workshops that the FNSP team organized, and also through the nutrition and hygiene courses, and also through the practical experiences in the communities, the various extension officers, and also the healthy workers. Food safety and nutrition are critical because they directly impact the health and child development, and also the economic well-being of the country as a whole. And as you already know, unsafe food can cause diarrhea, which can lead to malnutrition, and can also cause food poisoning, which can lead to illnesses and even death, especially among our children and pregnant women. And for example, before our food safety and nutrition awareness efforts, many of the communities that we work with, or the volunteers that we work with, they did not understand the WHO's 5 keys to food safety. But because of the trainings, now we are assured that the communities will now have proper nutrition, and also malnutrition related diseases such as anemia will also be prevented. The knowledge that I have gained through the training workshops organized by the FNSP team is being used to train other households on proper food handling, proper cooking, and also storage techniques. In addition to that, we are also supporting the households to have backyard gardens in an effort to have diverse and also nutritious and safe food. We are also working with schools through the school feeding, school meals program. We are also working with schools to improve the safety of the food that is being given to the children. And in addition to that, we are also working hand in hand with our colleagues from the healthy sector to advocate for hand washing and hygiene practices before and during food preparation, and even before consumption. Before the training, many of our community members did not wash their hands thoroughly before handling food, and we also having challenges of storage of food in unsafe conditions, which was leading to contamination. And we also relied much on limited and less nutritious diets, which increased cases of malnutrition. And also we're also having frequent cases of diarrhea among children. And after the training, now people are able to wash hands properly, and now they are able to store the food properly, like separating the raw and the cooked food, to cook thoroughly, and also they are able to know if the food that they want to buy is already spoiled or not because of the training. And some of the community members, they did not know where the expiry date sticker is on the food that they want to purchase, but now they know, and they are able to see the date and check whether it is expired or not. So the trainings have really benefited the community. One example that I can give is some of the families that left their cooked food uncovered, thereby attracting flies that later contaminated the food. But now, because of the trainings, they are able to cover and properly store their food. And now they have the freedom to purchase food that is not expired, and also they are now practicing hand washing with soap before preparing and during preparation of the food and before consumption of any food. And one other thing that has also stand out is most of the communities, they did not wash the vegetables before cooking. And after that training, most of the households that have benefited from this training, they are now washing vegetables and even fruits before consumption. And in addition to that, most of the households are having small backyard gardens so that they have access to safe and nutritious food.
For me, what was interesting is how she was able to describe the food safety process, like everything to the T, including the wash issues that we've been discussing. She was able to talk about, the contamination, the mycotoxins, and in a language that even somebody who doesn't really have, an academic background, I would say, would easily understand. And I felt like, now this is what community impact is about. Somebody who should be able to tell someone who did not have, the technical expertise that maybe Professor has, maybe Vitoe has, to be able to understand why they shouldn't be doing what they're doing. I felt like that was really impactful to me when I had the conversation with her, really.
The impact has actually bounced back to us because I would say before this engagement, I would mostly be in class and sometimes you would be teaching void. Because there's been a lot that I've actually gotten from the ground back to the students.
Yeah.
And it has made my teaching much more closer to reality because now I'm teaching, what's really on the ground. Now I'm able to understand the challenges that are on the ground, and now we've been co-create. So it's been very impactful on the ground, but also even to my students, and that is something that I also wanted to mention.
Wow, that's impactful. But now let's talk sustainability because, a lot of the stuff that would be... what I like, although I'm mentioning sustainability, is something that we've already discussed along the conversations. Because there's been a lot of, the documents that were created within this process are not just for GIZ or FNSP project. There are things that are global. Anybody, anywhere from any part of the world can easily access and be able to see and learn from. I would also love it if, our colleagues, across Southern Africa would be able, because most of our challenges are somewhat similar. It would be ideal or maybe helpful for them if they could listen to the podcast and be like, oh, let me just go and check it out. But also locally as a government, for me, it's something that they would use, I would say, in years to come. But it's a product, a legacy of FNSP. Vito, maybe you can correct me if I'm wrong, but that's how I'm seeing it.
You're very right. Actually, we've even taken effort, as Prof was mentioning. We are going to have the materials translated into the local language. So when we're producing them, they were produced in English, but now we are translating them into the local language, just as ensuring that they even reach the last mile. Because as we said at the beginning, if you look at food safety, usually the focus, and also if we talk about the mycotoxins, the focus by the masses out there is for the markets, like the other consumers, forgetting about the rural communities or the producers themselves. So even us taking effort to translate the materials into the local language is to make them easily accessible to the households. Because at the end of the day, the rural community also contributes to what we want to achieve as a nation, the economic impact. If the rural community becomes stunted, it also affects Malawi as a whole. And we're not just looking at Malawi, but we're also looking at the global economy. So those are the areas that we are also looking into. Yeah. And also in terms of, if you talk about sustainability, the capacity that we have also built amongst the frontline workers, it's something that will remain even after the project exits. I feel like that's what is very critical also for us as a nation to say, what are the capacities that are still out there when it comes to food safety? They should be able to continue handling the topic. I feel like even building the relationship with LUANAR, as Prof was saying, that he had interactions with the colleagues from the districts, the frontline workers. They've built a relationship and they continually engage. So even continuing the conversations, having the dialogue, the expertise that he can continue to input amongst the frontline workers is also very important, even after FNSP moves on.
I would just maybe want to find out from you, maybe Vitoe, at national level, because I know you started with engaging at central level. What do you think should maybe the government, so to say, our political partner of FNSP, should do to centrally support the food safety conversation?
No, thank you, Zainab. I think what we missed out at the beginning, because our interest was really in the community aspect. We've had this conversation more centered around the community.
Yeah, definitely.
But also at the national level, there's a lot that the project also does in supporting, strengthening the enabling environment at national level. And one of the areas that we focus on is the policy aspect, because as I said, at national level, our political partner is the Department of Nutrition, and these are the policy holders. So we've been part and parcel of developing or revising the nutrition policy. And within the nutrition policy, you also find components of food safety, not necessarily as a priority area, but one of the focus areas in the policy is on food safety. So already the fact that we've got food safety included within the policy gives us leverage, because at the end of the day, when the department is also measuring itself, it measures itself against the food safety. Yeah. So there are a lot of also activities or interventions at national level, only that maybe with the podcast with the conversation today, we mainly focused at the community level, because this is where the people are neglected. Mm-hmm. But at national level, things are moving. I wouldn't say maybe moving at the same pace, because also besides Department of Nutrition, there are also other ministries that are involved. If you look at Ministry of Agriculture, also food safety is one of their important elements that they need to focus on. So there are also other several players at national level.
Now, what does sustainability look like at community level? We had a conversation with an extension worker, and she had quite an interesting take.
To sustain these efforts as an extension worker, I plan to train more community volunteers in other areas who in which the FNSP was not there. We will continue training more community volunteers to continue spreading food safety and nutrition awareness. In addition to that, we also continue working with local health workers and also the schools to integrate food safety into their daily teaching practices. We also encourage peer-to-peer learning, where the trained households will share knowledge with the others. During these trainings, we also included the local leaders or the influential people in the communities and also the religious leaders. So we continue to engage with them, and whenever we get a chance, like having community meetings, and they are also there, we also keep on reminding them of the food safety training and the key messages, so that there is a continued awareness on food safety and nutrition. The knowledge so far is being managed by keeping the training materials and the guides that we source for reference. And in addition to that, we have also shared these training materials with ANCC members, like the Area Nutrition Coordinating Committee members, which comprises of the extension workers per TA. So the training materials have been shared with them. In addition to that, we are also using radio programs that we have in the FM, and also community meetings. Any community meetings that we find ourselves in, we also share the information. During our cooking demonstrations, we also conduct the practical demonstration on proper food handling, and we also issue food safety practices adhered to throughout the cooking demonstration sessions. In addition to that, we are also working with the district officer who works with the youth clubs. During their engagement meetings, the weekly engagement meetings, we are encouraging them to adopt food safety measures. Another thing is that we're planning to document success stories from the trainings to inspire more communities. Some of the challenges that we are facing is the first one has to do with the limited access to clean water. Some of the areas that we are working with rely on unsafe water sources. Thereby we are having a high risk of food contamination. Although we have trained them that they should be boiling water and also using water purification methods, or using like the water guard and chlorine if it is available. And another challenge is that we are facing is the resistance to behavior change. Some community members are sticking to the old practices, such as leaving food uncovered, cook vegetables we don't wash, we just cook them without washing. If we wash them, they lose taste or they don't get cooked thoroughly, things like that. And another thing is the issue of food security. That most of the families that we're working with, they struggle to afford nutritious food. Thereby, it's like they have no choice but to rely on cheap food, which is in most cases, a less nutritious option. And that's why now we are encouraging that they should have backyard gardens, so that they should have at least access to safe and nutritious food. And another challenge that we are facing is the poor storage facilities. Most of the households, the houses they lack proper food storage. whereby which also leads to spoilage. Maybe the house has some holes, it leaks, especially during this rainy season. And we also find that the same house, it's a one-bedroom house, and they are keeping goats, pigs, chickens in that same house, which is also, contaminating the food that they are eating.
I really like that the empowerment, as I would like to call it, is really something that you really focus much on the community. That, for me, is a very powerful thing. Because sometimes we tend to focus more on the central level. We forget that for these people to cascade, there will be a lot of resource involved, a lot of planning, a lot of what. And by the time you're cascading down, you're not really going as much as you would have loved. So for me, that you were empowering the, frontline worker. And I also like the multi-sectoral approach to how this was done, because you could have said, okay, let's just go through the nutrition, system, but production requires agriculture. And the frontline worker that does agriculture is the extension worker. And now, concluding, thoughts, Professor, I should start with you.
Right. I think for me, I would say academia without working with partners is void. And it's very rewarding when you work together. There's been a lot of learning, and there's been a lot of meaning to what we've been doing in my team. And moving forward, I would say this is exactly what we're going to be doing with other partners. It's been an excellent experience for us. We've learned a lot.
Oh, wow, that's great. Maybe concluding thoughts, Vitoe?
I think from my end, the fact that I mean FNSP, right? The fact that we picked up on a topic, food safety, which we never thought of working on from the beginning, and it turned out to be one of the interventions that we picked with positive results is a good thing. And I would also want to urge other nutrition projects out there to say, let's not be myopic, let's widen our scope when it comes to the interventions. Let's not look at, say, nutrition in isolation, but food safety is also very critical. And when we say food safety, even other players that are out there, let's not just focus on the markets. Because if we live out on the rural communities, these are mainly the producers also in the country. And if they are not well taken care of, then it also affects the markets at the end of the day. True. So if we take care of the rural communities where the producers are coming from, it's also going to translate into positive results for the markets. So it has got positive bearings for both. So the benefits are for both, right? The rural communities where the producers are, where the farmers are, and then also for the end users at the end of the day. Yeah, if you ask me about what we did and also what we've left behind, those are the things that I would think of. Thank you.
Well, as a host, I've also learned that you cannot really implement nutrition without thinking about food safety, because at the base of it, you can't have nutrition if your food is not safe, basically. Yeah, so if you are implementing nutrition, interventions, you could also consider the safety aspect of your food. And where possible, if you're in Malawi, we've got the Professor, Matumba here, you can reach out to him. If you're outside, maybe you could also look at maybe the academia as part of research and see how best you can work out. But if you just don't know where to start from, there have been some publications that the Food and Nutrition Security Project has been able to do. Professor did mention them earlier. Maybe, I don't know if you could mention them again, because I know there are a few that are available globally in several journals. Maybe you could just share them before we wrap up.
I talked about manuals, but now the main publication that is out there is called 5 Keys to Prevention and Control of Mycotoxins in Grains, a proposal. And this was published in Global Food Security. That's an Elsevier journal. And also, as we talk, we have another paper that is under review. And this one is a perspective where we are actually rethinking the WHO 5 keys, the perspective that we have, that we need to create another, sort of like modify the 5 keys to suit. So that is something that will come out in a couple of months to come. The other thing that I also wanted to mention, maybe just fit somewhere, was to say the very measures that one use to control mycotoxins are good agricultural practices. And these are the very measures that will actually boost productivity. If you plant early, for example, you will make the plant become vigor. But now that vigorous plant would actually produce a lot. So it's like a double win. You follow good agricultural practices, you get better yields, but also you get healthier products.
If you really want to find out more about this, information, Professor just shared where you can find those journals. But also in Malawi, the manuals, I'm sure that the Ministry of Agriculture.
Actually, they are going to be with the Department of Nutrition as the main custodian, but at the same time, they will also be made available in the districts. So these ones we are sharing as soft copies and also as hard copies. So we've got the manual. We also have the 2 counseling cards. Yes, and these ones will be made available in the districts. Mostly in the districts, yes, you're looking at the extension service, but mostly as an entry person, then it will have to be with the Office of the Principal Nutrition HIV/AIDS Officer, the BNAO. You've also interacted with some of them.
They are really interesting.
Exactly.
I really had good conversation. Actually, all of them came here for, our previous episodes.
Exactly.
Yeah.
So those ones are the custodians for those manuals.
Okay.
And everything from the manuals and the counseling cards will also be hosted on the website.
On the website, exactly.
On the website. So
Oh,
we
the
just want
LUANAR
to
website.
also,
Okay,
other
yes.
regions should also benefit from it.
Okay, so you can also check out the LUANAR website.
Yeah.
Is it www.luana.ac.mw?
Yes.
So if you want something, more, you can also check out the academic website of the Lilongwe University of Agriculture and Natural Resources, www.luana.ac.mw. You can also find this content. This has been Zainab Tisenga, your usual host, and in today's conversation, I was joined by Professor Limbikani Matumba, who happens to be the Professor in Food Safety, as well as the Dean of Faculty in the Life Sciences and Natural Resources Faculty at the Lilongwe University of Agriculture and Natural Resources in Lilongwe, Malawi. I was also joined by Vito Webach, who happens to be the nutritionist in the GIZ Food and Nutrition Security Project under GIZ in Malawi. And this is the end of our podcast series. I hope you've had a very good learning journey. And I also hope that you're also going to be adapting some of the content that we've been having in our series. This has been Over to You, and I do hope that you're going to be able to use so much of the content that we have developed, over 11 episodes. I usually say until the next time, but now I want to say that these lessons are over to you. Thanks very much for listening.